Hello, Sandra. Welcome to our clinical examination today, and welcome class. My name is Dr. Perez. Of course, you all know me as Professor Perez, and I will be simulating a complete diabetic assessment today with our volunteer patient, Sandra. So as always, she will not be responding verbally to most parts of the assessment. She will, however, follow my physical commands as I will be manipulating her ever so slightly. And the basis of the examination today is to show you guys how a regular diabetic assessment would essentially function in a clinical setting. So I will be acting as Sandra's doctor and performing all of the examinations accordingly. Okay? So to get started, just a couple of things to note. We do have our therapy cat in the office today, so we will be allowing her to roam around as she pleases. Sandra has already provided us with her consent for the examination today, so we can go ahead and proceed. Now, I would like you guys to, of course, make sure you are documenting appropriately, taking proper notations, and if you have any questions, you are welcome to ask. Of course, I will pause in between certain areas of the session, and you can ask questions accordingly. Okay? All right, so to get started, of course, you would typically log in and have your patient's portal pulled up. I typically have my scribe with me who takes notes for me, but for the purposes of today's demonstration, I will be doing that myself. Okay? All right, so Sandra, I'm just gonna go ahead and pull up your portal here this morning. So before we get started, I am going to ask you to confirm your first and last name for me, as well as your date of birth. We'll go ahead and get that inputted here. And I do have you popping up on our schedule this morning. Now, looks like Sandra is here for a type 1 diabetes follow-up. She was recently diagnosed as a type 1 diabetic. She's had symptoms for most of her life, but was not sure what they were associated with, and it turns out she is in fact a type 1 diabetic. So we will be performing several examinations today. Now, I just want to have a look at a couple things. I am going to verify that Sandra's vitals have been taken by the nurse, and it does look like all vitals were taken and mostly with the normal limits. So Sandra, it looks like your blood pressure was slightly elevated this morning, so I will go ahead and retake that for you. Okay? So typically I like to assess the patient's initial findings taken by the nurse or nursing assistant while they were in the waiting area. Sandra's vitals were taken, however, it does appear as if her blood pressure was slightly elevated. So for the sake of being thorough, we will go ahead and retake that. Okay? So aside from the blood pressure irregularity, all other vital signs were within normal limits. I did also have the nurse obtain your blood sugar this morning. Blood sugar today was 125, which is slightly above average, but you did eat breakfast, so I wouldn't consider that anything too concerning. We would have to look at a trend of your blood sugars, both fasting and unfasted. Okay? Now, if, for example, Sandra's blood sugar had been below normal or above, I would then retake it here in office just to make sure that I'm getting an accurate reading for myself and for her records. Okay? Can anyone tell me what a below normal reading would be? Yes, that is correct. And an above average reading? That is correct. Very good. So those are all numbers that will be on your test. So I do suggest if you don't already have those written down that you become familiar with them. Okay. All right. So Sandra, you are all checked in. At this point, I would ask if you had any questions for me today, if you had any concerns regarding your examination. She would then ask me those questions and we would proceed with the exam. So I am going to confirm that we do have your consent to proceed with the examinations today. I will be starting by obtaining a manual blood pressure. Very good. So I'm just going to set this aside. And I am going to go ahead and don my gloves today. Now, I would like to note that these are sterile gloves. Sterile gloves are not required for this procedure. It is just my preference this morning. Do be sure if you are donning sterile gloves that you still use proper protocol, okay? And of course, hand hygiene should be performed before and after you don and doff your gloves. Yes, that's a good question. So the reason I prefer sterile gloves for the diabetic assessment is because they tend to be a little more custom fitted as they come in different sizes. So I tend to prefer a 7. I just find that they are a little bit tighter around the finger and allow me to better palpate and feel around the patient. So if you prefer regular nitrile gloves, that is totally fine. I would just maybe wear them either a size down or just make sure that you're pulling them down onto your fingers appropriately so that you can feel the patient's skin. Moving on, class, we are going to go ahead and obtain Sandra's blood pressure. Now, I have a manual blood pressure cuff here. So, Sandra, do you have a preference which arm I obtain your blood pressure on? Okay. Now, I do always ask the patient if they have a preference, which side blood pressure is obtained on. If the patient does not have a preference, then ideally you would obtain it on the left side. Okay. Now, at this point in your clinicals, you should all know how to apply a blood pressure cuff, but I will demonstrate accordingly. Sandra, I am going to have you extend your arm for me. There is an indication here of where the artery should hit. So for the left arm, you want to line up the arrow at the inner elbow there. And cuff should go on taut but not tight. You should be able to get about 2 fingers inside the cuff at all times. Of course, we are going to clip our sphygmomanometer here. Sandra, I will have you relax your arm flat down on your leg for me. Please keep your leg straight down. Do not cross at the ankle. Make sure that your balloon is closed. You are going to don your stethoscope. Test for auscultation. And of course, place at the artery. If placement is correct, you should hear a heartbeat. Some people's arteries are a little more difficult to find. If your patient is overweight, you might have to push a little bit harder. So just things to keep in mind, okay? All right, so I am going to begin by inflating our balloon. Numbers on the sphygmomanometer should always be visible to you. And I pump up to about 220 depending on the age and size of the patient. 220 is about average. Sandra, I apologize if this is a little tight. It's just going to take a couple seconds and then you will feel it deflate. You are going to very slowly release. All right, so Sandra's current blood pressure is about 132/89. Slightly elevated, but certainly within the realm of normal limits. So it could have been that her initial blood pressure was elevated due to stress or anxiety of being at the doctor. There are several factors. So at this point, she is okay. Thank you very much. Of course, at this time, you would go ahead and proceed with documenting the retaken blood pressure. All right. So we can go ahead and move on, and at this point I am going to start with the actual diabetic assessment. Now we are going to start at the face, and initially, regardless of the examination, I like to perform a basic inspection of the patient's facial symmetry. Always want to do a stroke eval regardless of the examination. It's always good to rule out any neurological deficits to start with. So I am going to shine a very bright light over your face, Sandra. You do not have to look at the light, just kind of look off to the side for me, okay? So starting here, midline at the forehead, I'm going to come down the bridge of the nose, looking for any signs of asymmetry at the center of the face, any wasting of the facial muscles, any drooping of the mouth, which is not present here for Sandra. Also looking at the eyes, looking for any signs of tremor at the eyelid, which is not notable. I also do not note any atrophy at the brow bone. Very good. So also looking at the overall posture. Shoulders are well aligned. Just going to move your hair here briefly, Sandra. Having a look at the collarbone, not noting any signs of distension at the chest wall. Arms are midline to the rib cage. And hips do not appear displaced. So that is all very good. Now we can proceed with the examination of the eyes. Now the reason we test the eyes during a diabetic examination is to test for diabetic retinopathy as well as any loss of peripheral vision due to uncontrolled diabetes. Okay, so unfortunately, prolonged uncontrolled blood sugars can lead to loss of vision as well as damage to the retina of the eye. So, Sandra, I'm going to perform a brief examination with my pen light to your eyes. Now, initially, I would like you to just kind of look at me. Don't look directly at the light. So I'll have you look at me. Going to check your pupillary reflexes, so checking for the initial constriction and dilation of the pupils, which is noted. No signs of lagging there. I do notice a bit of over blinking, but that could be due to sensitivity. Sandra has very light colored eyes. So now I'm going to ask you to follow the light using just your eyes. So do not turn your head, just follow with your eyes. Very good. Very good. Any blurry vision or double vision with that, Sandra? Perfect. Okay. Now moving on to our second lighted tool, I will be taking my ophthalmoscope. To start, always make sure that you are set at a standard 10. And double check that your light is working prior to bringing the ophthalmoscope to your patient's face, okay? Sandra, I'm going to come closer in proximity to your face, and I will be shining my light directly over the eye. Coming in and having a look at the retina, looking at the optic disc, which is visible. No occlusions at the optic nerve. Changing my magnification here. No occlusions at the veins. Sandra, if I could have you look up for me. Sclera is clear. Good. Okay. So I'm going to repeat that on the opposite side. And you do need to be standing on the side that you are testing at the time. So, same thing here, Sandra, coming closer to your face. And visualizing the optic nerve. Optic disc is clear and normal in color. No signs of occlusion. No distension or bulging of the eye. Sandra, I'm going to have you look up for me. Sclera is normal, pink and clear, no signs of abnormal mucosa there. Very good. All right. I will go ahead and let you rest your eyes for just a second. I realize that is rather bright. Okay. So I'm going to use my light to check your peripheral vision, Sandra. Now this is just an initial test here. I'm going to bring my light in from the corners of your visual field. I would like you to indicate to me when you see it. So if I come behind you here and bring my light into your visual field, just indicate if and when you see this. Now, ideally, class, your patient would either verbalize with a yes that they see it, or they would raise the hand of the side they see it on. Okay, so for demonstrative purposes here, if I bring it in here, Sandra would say yes, 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 and yes. And we want to test all quadrants of the periphery. Is that clear? Okay. Thank you very much, Sandra. You are doing really well. Okay, so continuing on with the test for ocular health, I'm going to do a brief test of your ocular reflexes. Now, I have a clean cotton tip here. I'm going to bring this to the corner of your eye, and I will be instigating the natural reflex of your eyelid. Should cause you to blink. I don't want you to force it, and I don't want you to try to refrain from blinking. Just allow yourself to react naturally, okay? Good. And at the inner tear duct. Very good. So I also like to then bring the Q-tip towards the face. And again, this brings on your body's natural reaction to protect the eye. And Sandra clearly has that function intact. Okay? All right, class. Moving on to our final two tests for ocular health. I will be measuring Sandra's pupil size. Now we are measuring for symmetry between the two eyes. Any differentiation between either eye in comparison to the other could indicate either a neurological imbalance or damage to the retina. Okay? So I'm going to use my pen light to measure here, and we are at about a 7 symmetrically there, which is good. And lastly, a twofold test here checking for color blindness. We would ask our patient to indicate what color they see. In this case, we have orange, sometimes yellow, and gray. Both answers are acceptable. And again, we would ask Sandra to say yes or raise her hand when the test tube comes into her periphery. Okay? So you can also hold one out and ask them to say yes when the other color appears. So for example, Sandra, can you tell me what color this is here? Correct, that is orange. I want you to focus on the orange and say yes when the green comes into your peripheral vision. Good. 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 And if I switch, good, that is gray. And again, good, good, and good. Making sure you test all visual fields, okay? Now at this point, I will be testing a few reflexes of Sandra's upper body. Now, of course, this is more in line with your traditional physical examination. However, it is something I like to include in my diabetic assessments, as I find patients with a lack of sensation or peripheral neuropathy can have diminished reflexes, okay? So starting at the face, once again, testing ocular reflex here. Sandra, I'm just gonna have you relax as I tap towards your eye. Good. Very good. Very strong reaction here. Now I'd like you to note that the reaction is symmetrical bilaterally, meaning that we do not have one side that is closing while the other is remaining open. Okay? Sandra, I'm going to have you hang your jaw loosely for me. Good. Testing for abnormalities at the TMJ. And now testing upper extremity reflexes. I'm going to take your hand here and test at the elbow as well as at the wrist. Good. And lastly, testing at the second digit. Perfect. And repeating on the other side, I'm going to have you hang your weight in my hand, please. Good. And relax your hand for me. Very strong reaction here. Very good. Okay. All right. Now, of course, testing at the knee as well. I am going to simulate a reaction here. You would test very well on both sides, as well as at the ankle. Okay? All right, class. So we are going to go ahead and move forward in our examination today. And since we're working with the upper body, I will go ahead and continue on here. So, Sandra, I'm going to test your upper body strength in relation to mine. So, you would use your hand strength as about an average. Now, keep in mind the age of your patient could play a role in their upper body strength, of course. So, Sandra, I'm going to place this in your hands. So, if you could extend both hands for me. You're going to hold it in both hands with a tight grasp, and I'd like you to pull it apart as far as you can. Very good. So no issues with strength there. Now I'm going to have you rotate your hands for me. And again. Very good there. Now if I can have you bring one hand behind your back. I'm going to hand this to you. I'd like you to grasp it with your other hand and pull away from you. Very good. So some cracking at the elbow there, but that is normal. And we're going to repeat the same on the opposite side. Good. And again, pull away. And again, some cracking at the elbow is expected. Okay. Now, of course, be careful with this band that you don't just let go of it and accidentally snap your patient, because that can be quite painful. All right. Moving on to a couple brief tests of upper extremity mobility. Sandra, I'm going to have you hold your hands out like this. Very good. And if you could pull in towards yourself and push out towards me. Now just at the wrist. Push out. Very good. Okay. Now I'm going to have you relax your arms and shrug your shoulders. So shrug up towards me. Good. Okay, so all of that is fine. Now lastly, for facial strength, I'm going to have you turn your face towards my hand and this way and back and down at the chin. Good. So all of Sandra's facial and upper extremity strength and mobility is intact. Okay? Obviously, if you found something that you felt was abnormal, then you could do some further testing. I am going to go ahead and move on to a couple tests for both neurological functioning and sensory function. So I have a collection of tools here. Sandra, I am going to place tools in your hand. Now I use the word tools in place of the word object. And I'd like you to just verbalize to me what it is that you are feeling, okay? So I'm gonna have you close your eyes and place an object in your hand, and you are welcome to feel around at the object and indicate to me what you think that is. Now, a correct response in this case would be that this is a binder clip. And to demonstrate for you all, I have fairly identical objects. One is quite larger than the other. So we are going to then hand Sandra the smaller binder clip and see if she is able to identify that. So she would likely tell me that that is a binder clip. Some patients volunteer that it is smaller or larger than the initial, some don't. So following that up here with this object. Now that is a carabiner. I would then vary the test by handing her the smaller carabiner. And instead of asking her what it is, I would ask her if she can tell me if it's the same or different than the initial item. So she would then tell me that it's the same, but it's smaller. Something like that would be an appropriate response. Lastly, I have two different size paper clips. Starting with the small one this time, I'm going to ask Sandra to identify the object. I'm going to hand her the second paper clip and ask her if it is smaller or larger than the initial, to which she would indicate it was larger. Okay? All right. Very good. So that gives you a little bit of an idea of your patient's neurological functioning, if their sensory components are intact. Obviously, if she was having some issues with sensory function of the hand, she would have difficulty feeling and identifying the object itself. Okay? All right. Sandra, we are going to go ahead and move on, and I am going to test your upper body sensory component. Now, the reason for this test is because obviously you are a newly diagnosed type 1 diabetic, so we want to make sure that all of Sandra's sensory functions are intact. Now, this test will mostly be performed on the lower extremity, mainly the feet. I do, however, like to test on the upper extremity just briefly to ensure that there are no deficits there. Okay? Does anyone have any questions so far? I am moving rather quickly this morning. Okay, so we can proceed. Now, Sandra, I'm going to start with our initial test, and this is going to be just a test to see if you can feel the object. So I'm going to have you close your eyes for me, and you're just going to indicate with a yes or nod your head if and when you feel something. Now, class, you want to test in a varied motion. You don't want to perform a linear test where every sensation is exactly the same, or in a manner that could allow your patient to identify a pattern that would then give you a false reading. So moving on to our sharp sensation, Sandra, I'm just going to give you an example here at the collarbone. Can you feel that that's rather sharp? So I'd like you to just indicate to me yes when you feel something sharp. Good. Very light pressure here. The pressure should be so light that when you touch your patient, your fingers slide down, okay? So we're not causing any pain or attempting to nick the skin. We are simply inducing a sensory response, and then you would vary between the sharp and the dull, okay? All right. Now, Sandra, we have completed the initial portion of your diabetic assessment. You can go ahead and open your eyes. At this point, I am going to have you lay down on the table. I will position you accordingly, and I'll begin with the assessment of your lower extremities and have a look at your feet, okay?